Hey everyone, thanks for joining us for another deep dive. Our listeners sent in some pretty interesting stuff this time around. It's some clips from this YouTube channel, The Ring of Fire, and it looks like they're talking about some big changes to government websites during the Trump administration. So we're going to dive into that and figure out, what exactly they're saying was taken down and why it matters.
Yeah, absolutely. We're going to be focusing specifically on the claims laid out in this particular source material. And the big takeaway that they're presenting is that thousands of pages of information disappeared from these websites in a pretty short amount of time.
Yeah.
And they're attributing that to direct orders from the Trump administration.
Okay, so let's jump right into it. What exactly is this video saying was removed? I know they're talking about things like civil rights information, maternal care, general health care stuff, and even environmental justice. But can you give us some more specifics about the content itself?
Sure thing. So the transcript that we have, it highlights quite a few different agencies that were affected. For instance, they're saying that the CDC website saw a lot of its public health resources removed. So things like, guidelines on HIV and STIs, information on Alzheimer's warning signs, and training materials for overdose prevention.
Wow.
Yeah. Oh, and even vaccine guidelines, specifically those that referred to pregnant people. And that's interesting because the video actually suggests that the use of that specific term might have been a factor in the removal.
That's very interesting. I wonder, what the overall impact would be of losing access to those resources.
Right. And it's not just limited to that. They're also saying that the CDC's Social Vulnerability Index, the tool they use to assess community risk during disasters, that was taken down too.
Okay, so losing something like the Social Vulnerability Index, that could have a real impact. The video also mentioned the NIH saying that they removed a whole portal with a ton of info on maternal morbidity and mortality, which is super important for understanding the health challenges that expectant mothers face.
Absolutely. And it doesn't stop with the health stuff either. They're claiming that over 1,000 pages were removed from the Office of Justice Program's website. And get this, all state-level data on hate crimes was taken down from the DOJ website, too. So that's a huge chunk of data relating to public safety just gone.
That is a huge amount of data. And on top of that, the FDA reportedly removed nearly 100 pages of its own, including info about expanding diversity in drug trials. The video even speculates that the mere mention of diversity could have been the reason behind it.
Yeah, that's how the video is interpreting it, at least. And then there's even more. Hundreds of pages removed from places like the Head Start program, the IRS, you name it. And the Department of the Interior apparently got rid of pages that mentioned environmental justice, too.
So what we're seeing here is that they're claiming a really wide range of info was removed. Information that affects public health, safety, and even our understanding of all sorts of important societal issues. And the source is stressing that these were vital resources for the public.
Exactly. The video is framing these removals as very intentional and politically motivated, like it's suggesting a deliberate effort to limit public access to all of this information.
So to recap for our listeners, what we've looked at today is this source that's claiming a widespread removal of data from government websites. This happened during the Trump administration and supposedly affected areas like civil rights, healthcare, environmental justice across a ton of different agencies. And the video is interpreting it as a deliberate act, one that could have some pretty big consequences for public knowledge.
Considering the sheer amount of information that was reportedly removed, everything from those health guidelines to crime statistics, it really makes you wonder what kind of implications this has for government transparency. What does it mean for our access to these vital resources? It's definitely something we're thinking about.
Definitely. Thanks for diving into this with us, everyone.